All right, in the second part series of our Meaningful Use Acceleration webinar series, today we're going to be talking about vendor selection. The last time we spoke on project management, and you can take a look at that on our website at healthpoint.dsu.edu/project management. Today, once again, we've got Holly Ahrens, our Clinical IT Operations Manager, who's going to take us to that second phase, which is vendor selection. And with that, I'm going to turn it over to Holly.
Thanks, Jeff. Today is going to be vendor selection, and I'm going to be giving you some practical tips to navigate that vendor selection maze. First thing that you have to do to ensure that you are able to successfully navigate the maze is to prepare. Preparation is probably the most important key to this whole journey. Make sure that you have executive leadership support for this project, that you have established a project charter that outlines the goals and expected outcomes. A physician champion must be identified. EHR adoption team has been identified. A communications plan has been created. You've conducted your EHR readiness assessment, and you've done workflow assessments to identify your clinical documentation needs and workflows. You're now ready to enter that vendor selection maze. Now, the maze can be confusing by the number of products out there. In 2006, there were over 400 EMR vendors in the marketplace. They had varied functionality, and I can tell you that all of them want to sell you their product, so they always are promising. Don't be distracted by the bright, shiny objects. That is those types of products that promise everything but don't have much to deliver. You want to make sure that you do your research. Make sure that you understand in your organization what are the deal breakers. What are those things that if you saw that either as a characteristic of the vendor or of the product, that would be absolute yeses or absolute nos? Start networking with your colleagues. Find out what other practices are using in terms of EHR products. What do they like? What do they dislike? Begin to educate yourself and your team on the different types of EHRs that are available. The software as a service model or the SaaS model, web-based, hosted, a complete EHR versus a modular EHR. Then begin to start narrowing down the types of EHRs that you would like to see demonstrations of their products. The next part of the maze is moving into product demonstrations. This is where you're going to be scheduling a demonstration with the EHR vendor and having your EHR adoption team members present. Ensure that your vendor representative has use cases that are applicable to your setting to show you. Now, you can either submit these ahead of time to them, or you can probably select from a list they may have. You can also submit your questions before the demonstration to ensure that they answer them. Have your needs list handy so you can ask them to show you functionality that you're interested in. Always remember, these are salespeople, so have some level of discernment when listening to their answers. Avoid yes or no questions. Always ask, how will this work? Next thing you want to have available to you during those demonstrations is a vendor evaluation matrix. This organizes your questions and gives you a place where you can document the answers for each one of the products that you see. So during these demonstrations, make sure you assign someone on your team to be the scribe to ensure accurate information is recorded for review later. After you have completed the demonstrations, you're going to be selecting your finalist. Much like the task of picking your Final Four in basketball, you have to start selecting the finalists of your EHR vendors. This process should be based upon your needs list or your assessment that you had developed and how much each EHR matches your needs. The needs that have more weight should be deciding factors if there ever is a tie between vendor products or if you need to make decisions within your team. Well, if you've narrowed it down to your final 4 or your final 3, whichever that is, it's time to schedule your site visits. Vendors will give you a list of potential site visit locations, or if you have colleagues that are using the product that you are considering, you could ask them directly to come and visit their location. We have a site visit checklist that makes it easier for you to conduct the site visits. You should have no less than 2 people from your organization and assign each a role, at the minimum a scribe and a leader. Now I'm going to read off some of the best practices from our site visit checklist. So make sure you bring with you some type of note-taking device, sample of super bills or how you bill, a lab layout, a copy of a contract or a contract template that the vendor possibly had provided you with. Now you're going to want to meet as a team initially with the site visit leadership or with their EHR adoption team. And the first things you want to know are very general questions about how they're doing now. How was the process of implementation? What was their deciding factor for selecting this particular EHR? What's the customer service like? What were some of the unanticipated costs? And most importantly, what would they have done differently? Also ask about guidance on interfaces, different go-live phases, customization strategies, and how to get through that process seamlessly. Next, you want to take a tour of the facility. Some of the things that you're going to be looking for are placement of computers. Are they able to use tablets or handhelds? Look at their server room. How large is it if it's hosted there at the facility? What's their HVAC look like? The placement of scanners or faxes, any barcoding or biometrics that's used for login. What are their e-prescribing activities? Check out their workflows. See if you can sit and watch a workflow of a patient through the entire process, rooming the patient to checkout. Look at their pharmacy if they have one and evaluate the workflows there and how they keep inventory. On the clinical side, you're going to want to make sure that you identify how they're capturing documentation, how the interview is done with the patient, whether it is a computer being used within the room or if they are charting on paper and then would have to go into a room with a computer and chart. Look at their customization or their templates. Check their encounter summary or the office summary and see what that looks like, if it has been a direct report out of the EHR or if it has to be customized. Look at their order entry, their e-prescribing, how they close a chart, and their clinical decision support tools. Ask them how much their productivity has decreased and if it has increased since go live. Next, look at their billing practices. Make sure that the coding between their EMR and their practice management system is done seamlessly, or if they need a coder to do that. Look at the billing reconciliation at the end of the day. Look at their integrated systems of how they capture the bills. Next is the lab. See how labs are drawn, how orders are entered, how results are posted. And then take a subjective evaluation, just the general health of the team during implementation, what was the approach to problem solving, what was the accessibility of the vendor during that time. Make sure that you conduct a debrief after each visit within 24 hours of the visit. Now, make sure you don't make a wrong turn here. It's very easy to get caught up in the procrastination monster here. You know, this is when we get in the habit of dragging out the time between site visits, putting off the debriefs. This leads to poor memory of the visit, and you really lose that sense of urgency of the project. And some of this happens when you're trying to schedule the visits, but stay on task and stay focused. Well, at this point, after you've done your site visit debriefs, it's probably pretty evident of who is meeting or who is not meeting your needs. So schedule a decision meeting with 1 to 2 weeks following your last site visit. At this point, make the decision. Use your needs list and your matrix to identify who actually does meet your needs. Notify leadership of your choice, and let me tell you, now the fun really begins. Now we're moving into the part of the maze of contract review. Now, review of the contract is required. Make sure that you do not just sign a contract that has been presented to you from a vendor. Contracts are very complex. They're full of jargon and terminology that you may or may not understand. Ensure you know what you're getting and what you're not getting. And we do have these available to you. Well, once those negotiations are completed, you're ready to sign that contract. After the finalization of the contract, you'll be assigned a project lead or maybe an implementation specialist. There's different titles at different organizations, but essentially, this is going to be the person leading you through the implementation phase of the EHR journey. They're going to provide you with a timeline for implementation. And I can guarantee you this is not a customized or an individual timeline usually. This is a generic timeline. So you're going to want to review this timeline, see if it fits with your organization. At this point, you're on your way to a whole new journey of implementation. So let's just wrap up a little bit here. You're now ready to traverse that vendor selection maze, but always remember, prepare before you enter that maze. Know what your needs are. Be assertive during demonstrations. Ask questions that are based on your needs, and make sure you have use cases that are applicable to your organization. Always conduct site visits to see how the product works in everyday workflows. Don't drag out this portion of the EHR project. Stay focused and stay on task. And always involve an attorney for contract review and expect revisions and negotiations. That concludes today's vendor selection topic. And Jeff, I'm going to hand it back to you.
Okay, well, thanks, Holly, for walking us through the vendor selection maze today. And for everyone out there who's looking for more information on this topic and others, please take a look at our website at healthpoint.dsu.edu. You can also contact us at any point in time at 605-256-5555. Until then, we will wish you well and hope that you have a great journey on your way to meaningful use.